If you are eating high potassium diet and at the same time your medication is also telling your body to hold on to more potassium, that is potassium sparing, this can lead to a dangerous buildup of potassium in your blood. What is that classic healthy on-the-go snack we all enjoy eating? Banana, right? I know. This is a fruit that is not only delicious, but it is also very nutritious. Yes, it is packed with potassium, which is very useful for our blood pressure. It is also packed with vitamin C, which is good for our immune system as well as our skin. It also has other nutrients like vitamin B6, which is very useful for our brain development, as well as manganese that is very useful for our cell development. But what if I told you that this banana could be a very dangerous combination if not taken carefully with some of the most common high blood pressure medications we have, like lisinopril, enalapril, or potassium-sparing diuretics? This is what we'll be talking about today. So let's dive into it. Think of this image as our kidneys, which by the way is an amazing organ. It does the job of filtering our blood and also keeping our potassium at a perfect, safe and balanced level, not too high or not too low. And also think about those medications I listed, lisinopril, enalapril, and potassium-sparing diuretics as medications that help lower our blood pressure. They also work in parts to tell our kidneys to retain potassium. That is, it should not remove excess potassium. Why? Because losing too much potassium is also a very big problem. You do not want hypokalemia. Hence that word potassium sparing. You get me? Now, bananas, potatoes, and leafy greens are all fantastic and healthy meals, but they are also highly packed with potassium. Well, here is where the conflict is. If you are eating high potassium diet and at the same time your medication is also telling your body to hold on to more potassium, that is potassium sparing, this can lead to a dangerous buildup of potassium in your blood called hyperkalemia. This is very dangerous because it can disrupt your normal heartbeat, resulting in irregular heart rhythms, muscle weakness or cramps, and in very serious cases, cardiac arrest. Please, this is not something to ignore. This is not to get you to panic or to discontinue your medication because you're eating bananas, or to stop eating bananas because it's healthy and it is a very good part of your diet. This is all about communication and awareness. I am simply trying to let you know the dangers involved in taking a lot of bananas because it's packed with potassium and also taking these medications at the same time. One of the most important things you need to do if you are taking bananas as part of your diet, or if you're taking any of the medication I listed, is to always communicate with your doctor. Ask your doctor, please, what are those dietary restrictions that come with this medication? He would most likely order a blood potassium test to be carried out for you to check if your potassium level is, if it's safe for you to be consuming bananas while you're taking the medication, or if it's too high. So he would tell you to not eat bananas at all because of course you have to choose your medication over bananas. This is how you stay safe. It's all about balance. And another very important thing you need to know if you're on potassium diet and also taking medications is to know how it feels to have hyperkalemia. That is, know the symptoms of high potassium, which includes nausea, irregular or slow pulse, weakness, or tinkling sensations. So please, if you are on a potassium diet, taking bananas, and you're also taking any of this medication, and you experience any of those symptoms I just mentioned, call your doctor right away. With knowledge and regular potassium level checks, as well as an open line communication with your doctor, you can manage both your health and your potassium diet safely. If this video was useful for you, do well to like, share, and subscribe. And also, share it to the people you know this may actually help or be useful for. Turn on the notification bell so you would be the first to be notified when I drop the next video. And until then, lead a healthy life.